Hi, tell me about yourself. Who are you?
I'm Inura Welathanthri from my name, and I'm the final year medical student. So, a part of the study materials, I'm a ruggerite since grade 3. That means in the school days, and even I have played for the university rugby team also. Since this is the final year of my medical curriculum, I had to stop that for a bit because it's a bit hard to handle my rugby sports and the fitness thing and plus academic thing. So now during these days, I'm only doing my fitness stuff and academics.
Right, so about the fitness stuff and academics, how do you balance both medical studies and your fitness stuff?
It's like if you have it's not the motivation, actually it's a discipline. If you need something so badly, you have to give your time, courage, blood, sweat, everything for that. So it's like this. If you want to watch a movie, even though you are studying, you will find the time for that. So it's like, yes, even during the fitness stuff. So rather than going for the movie, I prefer that thing. So it's like in my routine. So I find some time for going to the gym and do some workouts. After that thing, it's only 2 to 3 hours per day, no? And also we don't need to go to the gym each and every day, so we can manage it at least for 3 days per week, like that. So that's how I manage my academics and fitness stuff.
Right. So you mentioned about discipline.
Yeah.
How does discipline apply to your studies?
It's like it's like this. If we have there are things like we have to do, we must do, and we should do. It's like, so in the medical curriculum, any curriculum, it's a must to study. Otherwise, we can't get our degree. That's the thing. But in the discipline, that's the way how we are trying to do that. It's like we find shortcuts, and also in the mean of shortcuts, they need to be effective rather than we are just trying to fix and go around things. So in the discipline, we have to sort about what we are going to do and how we are going to do, how we are going to retain all those things for a longer period. Because if we are going to study something and after an exam, if we can't remember that thing, we have to study that thing again and again. However, we have to study things again and again, but at least we have to retain something in our brain. So that's where we have to apply the discipline for the academics also.
Right, so discipline academics and in staying fit. What motivates you to do both of those?
It's like this. Actually, since my school days, I do fitness stuff. But when we got a COVID period, I had to stop those stuff. So I had to stop those stuff. So because I was staying at home and I was not playing rugby, so I was in the home. Then I was eating. One day, then I went in front of the mirror and I saw my most fatty version of myself. So I was thinking like that. Then I was holding my belly like this. Then I was thinking, what I have done to myself. This is not me. I can't stay like this. So since that day, I started working out again. I started from the body weights. There was no gym at home, no. So that's why I started again. Then after that, I was continuing. Then I was losing my weight. I was doing some heat exercises. That means more of cardio, and there is no strength training because there is not much weights. I was doing only the body weight exercises. So I again started that. Then I was thinking about if we are going to stop something just because of exams for a longer period, we are going to demotivate again. So the most important thing is, if we are following a workout schedule at least around 2 to 3 hours, during the exam days we can reduce it at least for 30 minutes or 1 hour. Right. It's not even each and every day, no? Only 3 days per week. That's more than enough, I think. So during those days we can do some cardio, just like you don't need to go for a gym to do cardio. If you have a skipping rope and if you can jump at your home, that's more than enough. That's what I was talking about.
Alright, so for medical students who just want to start working out and to keep fit, what is the basic routine that you would suggest with everything that they have at home without going to the gym?
Without going to the gym. It's like, so if we can categorize it like this. there are some people who have gone to a gym, but now they have stopped because of the academics. And there are some people who never go to the gym, but they want to start. So for the people who have gone to the gym, they can start with some strength training activities like push-ups. If they have a bar, then do some pull-ups, and also they can slightly maintain a push-pull legs kind of a schedule. It's like during the push days there are particular exercises, in pull days there are particular exercises, and the leg days it's all about the leg day. But when we talk about someone who is going to start new these workouts, they can start with simple basic exercises, just like few push-ups, few pull-ups. So even though they don't have equipment, they can use their body weight. It's like, it's already, if you have the motivation, you just have to go for the YouTube and search what are the full body exercises we can do at home. It's not a huge thing, because even during our pre-prof days, that means I was the chief coordinator of the sports club, so we were coordinating a fitness challenge. It's like we were challenging to it's like we are doing 20 burpees per minute, and then we are mentioning some people to do it like that. So at least we are mentioning 5 to 10 students who are doing medicine in the same batch, or seniors or juniors. It's like that. So then when we challenge someone, so he or she has to accept that, no. However, it's like 20 burpees per minute. That's how we started. That's how we started to get involved in the medical students for those fitness stuff. So it's like that. We can start from somewhere. The main point is we have to start from somewhere. If we start, we will continue. Otherwise, we'll never do that.
That's very true. So that was a lot of insight, actually, very insightful. So I have a little question about your social life. As a medical student, I'm sure there's sacrifices with your social life, right? And with academics and fitness as well, how has managing all of that been going?
It's like we can't be a gym rat. That's what people are telling, that if he is going to the gym, he is only in the gym, there is no social life for him. So if gym rat life is healthy, if you are choosing the social life also, if you are not going to incorporate your social life, you won't be healthy. It's like you are only seeing some plates and some people, limited people in there. But in my case, it's like during the pre-prof days, not in this year, it's like we have clinicals. So we have to be at the hospital at least around 7:30, 7:45. So we are going for the clinicals, then we are going for the lectures. Then after the lectures, we have time to study, go somewhere else, go somewhere wherever we want, or we can go to the gym, or we can do a sport. It's like, so in our university, it's around 3:45, they are ending the lectures. So you just have to take a meal packet or something, grab something, then usually I'm going to the gym. It's like only for 3 days per week. It's Monday, Wednesday and Friday. So those are the days I was going to the gym. So other than that, there are 4 days more to enjoy your life. That means go to the gym also enjoying your life. If you don't like that, you can't do that.
That is very true.
You have to enjoy the moment, otherwise you can't continue it, no? So in the other 4 days, you have your friends and you can go with them, have a chat with them. It's all about, it's like managing your time. It's like you have to know about what are your priorities and how you are going to categorize it. That means how you are going to stage them. What is the most important thing for you? It's like that depends on the time. It's like even though you need to compete for a bodybuilding thing, you can't do it during your exams because you can't get excuses. No? So due to that period, you have to prioritize your education stuff. So other than that, study leaves or other days you can do that. You can go to your usual routine, I think. So that's how I think you can maintain a social life. It's like you, however, daily you are meeting your friends, and also you can have contacts with your school friends also. So you don't need to limit it to your batchmates or faculty friends. We used to have so much of friends during the school time, but the thing was, they get into the university and we are getting into the universities, and all people are getting busy with their work. But if we, at least we can call them once in a while and ask Machan kohomada, that's the thing I think. So when we talk, we can arrange anything, at least for going for a day out. If we can't go for a trip, that's even enough, no? Just going for a coffee or something. That's what I think.
That's very insightful. I was just going to ask you about effective time management, and you covered that all very well.
Like when I get into the medical life, actually I was the first batch representative of my batch.
Okay.
So during these days I went for the lectures like that. But after that, my time was in the faculty, was not in the lecture rooms. It's like I was going to the gym and practices. My most fascinating events, all of them are happening in my ground and the gym, because it's like when we are playing a sport, that makes a team unity. It's a team spirit. So it's like actually it's not a teammate. There's no any teammates. All are brothers.
Yeah.
That's what we are thinking. It's like even during a match, if someone get a tackle so hard, that pain also feels us. That if he feels a pain, we can feel that also. So we are going to attack other people more than them.
Yeah.
So during the rugby, it's like it's all about the brotherhood. There is no any teammates. Everyone is a brother. Even a first year, second year, final year, we don't give a shit about that thing. We call them. It's like, yeah, we all are brothers. When we get into the ground, it's like we are not the same person in life when we get into the ground. It's like if you get hurt, Machan, I'll take care of that. It's like that. During the rugby sports, you can see so much of sports. In rugby, no one like to go out from the ground even they break their arm, leg or something. Even though they concussed, they want to play. That's what rugby brings to the life, I think. It's like we can survive in any situation of the life.
Yeah.
That's what I was thinking. It's like it's all about the rugby. And my most fascinating times in the uni life, they were all in the ground and even in the university ground and the other grounds which I have played.
Yeah.
Those are my favorite memories in the university life.
So in terms of advice, final words, what is any advice do you have for students who are struggling to find time for physical activity while being engaged in studies? Not just medical students, but also studies in general.
Yeah. It's like students are, first of all, we have to be realistic, because people are thinking that going to the gym for at least a month, you can burn your calories and you can be like Chris Bumstead or someone like a bodybuilder. So you can't do that, because those are the facts you have taken for years. So you can't burn them in a month. It's the most important thing is mindset and the consistency. You are not going to see your results from 1 week. You have to continue consistently for it's around 3 months. Then that's where you are trying to see your progression. So you have to continue that. It's like we can start from basic exercises. From the first day onwards, you don't need to go to lift heavy weights. You can't do that because there's a muscle memory and muscle adaptation. When you are exercising regularly, then the muscle becomes more stronger and you can bear some weight. That's how it works. Even during the studies also, we didn't get into the medical faculty or university at once, no?
Mm-hmm.
We have to start it from our nursery days. Even before getting to the nursery, we have to write our basic alphabet letters. So first of all, we have to start you can continue. You can start from 1 hour per day. I'm not asking you to continue it for the all 7 days in the week. It's like you just start for 1 hour per day. Then you will get addicted to that, because when you are seeing your progression, you will like that. It's like during this generation there is a huge topic when it comes to body shaming. People are body shamed so much. So some are getting depressed because of that. Some are getting motivated. So the most important thing I want to say is get motivated from those things. It's like insults are a motivation to make you a better version. So I think it's start whatever you do, even though you study, even though you work, whatever you do, you have to be in a good mental and physical health. So if you are going to maintain your physical health, it is you are getting your mental health, because when you are seeing yourself so pleasantly, that's a motivation for you to continue your other works even during the day. So just start from somewhere. The most important thing is start, and the consistency.
Consistency
That-
indeed.
That's the key. Consistency is the key. Otherwise, you are going to the gym for 1 week or 2 weeks, you are not getting huge muscles, then you stop. Again, you are getting into the usual pattern which you used to be. So the most important thing is you have to start from somewhere, then you have to continue with consistently.
All right.
Yeah.
Thank you very much for all of those insights. And thank you for your time. It was very insightful.
Okay, thank you.